So again, dunggan ako ha. Can you hear me? Okay lang? Yes, okay ra, dears? Can you hear me? Okay ra?
Yes, sir.
Yeah.
Alright, sige. So we'll start first with, of course, dears, ay galing I love safety. Okay? Basta yung kita dito na murag, bigyan na kaya na, sir, kay murag, gosh, love safety, kinaon na charot. So take note, dears, na dyan po yung love safety, and dako po siya na percentage sa inyong POS, and as it should, dapat lang, no? So love safety and QC, katong first handout, pwede ka tuloy itong tunan yun. So take note of katong mga acronyms, katong mga PDCA, PDMAI, mga PD, sa to, PDSA, ganun, no? So take note of that. So we'll start first with the degree of hazards. Take note, di ba? For degree of hazards, bahala po sa na hazard, this is the degree, no? So 0 to 4, again, sa mnemonics, no SMS, excess. Okay? Pwede siyang na-S diri, no SMS, excess. So no is 0, no hazard. 1 is light, 2 is moderate, 3 is serious, and 4 kay extreme or severe. Okay? So that's no SMS excess, all right? Um, no SMS excess, okay? I'm sure hindi na makaya sa uban. No SMS excess, again, that's the mnemonic for the degree of hazards. Next, of course, hand washing, alam nyo na yarn, okay? The last step is turning off the faucet with a clean paper towel, all right? Interference contrast microscopy, remember, it's also a bright field microscope. So you can employ the bright field microscope to become an interference contrast. Next, of course, magnification. Initial magnification, you have objective. So question, Anna, is which of the following provides the initial magnification of an image in the microscope? Of course, that is your objective. Final magnification is sa oculars. Remember, di ba, objective, ang light mo agi una sa objective, and then followed sa oculars. And then, of course, total magnification, i-multiply rin mong objective magnification times oculars na magnification, which is always 10x, di ba? Or 10, di ba? So, total magnification for LPO, so 10 times 10 is 100. For HPO, 40 times 10 for 400. Okay, so basic, wait, alam na yan. Okay? Alright, sige. Next, of course, you have who discovered microalbuminuria? You have Frederick Deckers. By boiling urine, nakita niya ang microalbumin. Next, of course, dears, as I mentioned, the NFPA diamond symbol. Naku, sana naman, dears. As in, kabalo mo, if magawa sa dyan ng mga lab safety na questions, ano na gina siya? Very, mag-praise the Lord na kaya mag-press the buzzer. So these are all very additional points na gini siya kaning mga lab safety. No? So take note, kinsa ang blue quadrant, you have again the health hazard. And again, how do we remember the colors? You first draw a diamond, di ba? Diamond, hindi na maklaro. Okay. Ring light end. Diamond, and then you start with right, di ba? So you were born right. Okay? So you were born right. Y is yellow sa right na side. And then you have W, W for white, ayan. And then you have again blue, ayan. And then red sa taas. So you were born right. Then take note, ato mga mnemonics, how do we remember the numbers, no? Unsay meaning sa yung hazard. So again, you have for blue, for health hazard, diba? You have N-shed, so normal, slightly hazardous, extreme danger, and deadly. For your reactivity, you have SUV, SM, no? Musakay kag SUV, padulong sa SM. So you have stable, unstable if heated, letter V, violent reaction, or violent chemical reaction. S na po, shock and heat may detonate or deteriorate. And 4 kay may deteriorate or detonate. So take note, dears, NFPA diamond symbol, hindi ka na mawala, no? So take note of that. Like, what is the number 4? Or number 4 in the blue quadrant. Number 3 in the yellow quadrant. Okay, so take note of that. Okay, electrical, what is this type of fire? Of course, class C. Remember, kuryente, no? Kuryente, electrical. Letter B is basa, all right? So that's for flammable organic chemicals. And class K, kitchen waste, no? Or cocina, all right? Next, for your analysis, of course, capacity of container is 50 ml. Pero atong kailangan na volume is about 10 to 15 ml or an average of 12 ml. Primary organic component of urine, of course, it's urea. And primary inorganic, naku, wag na mag-isip, it's chloride. Alright? Take note of that. Naku, mga Press the buzzer na yun. Oliguria, decreased cessation of decreased urine output, less than 400 ml per day. Anuria, complete cessation of urine, so wala na urine. Polyuria is increased output of urine greater than 2.5 liters per day. Alright, and again, unsa to mga analytes na mo increase in unpreserved urine, unsa to mnemonic? Pabaon. Yes, pH, bacteria, odor, and nitrite. So take note here sa pabaon. Alright. So do not be confused with pabaon and papabun. Okay, like po si papabun. Si pabaon, it's for those that will increase in unpreserved urine. Pabaon, pH, bacteria, odor, and nitrite. Alright. 17, interferes with drug and hormone analysis. You have boric acid. So mo-interfere siya with drug and hormone analysis. Pero, kinsa man tong preservative na best for drug analysis specimens? You have the answer?
Sodium fluoride.
Sodium fluoride.
Sodium fluoride. Take note of that. All right, very good. Okay, so that's for the preservatives. I'm sure expert naman kaya ang first chapters yan. So dapat na, na-memorize sa tanan-tanan. All right, okay. Next, you have, we go now to your, okay. When routine urinalysis and bacterial culture are both requested on a catheterized or midstream clean catch MSCC specimen, again, unsa to i-prioritize si bacte. Micro culture should be performed first to prevent contamination. All right. Next, turnaround time. What is turnaround time? It means the time of ordering a test through analysis until mabalik or ma-report na to the doctor, all right, or to the charting of the report. Okay. Next, of course, chain of custody or the chain of evidence. Again, step-by-step documentation from handling to processing to release of results, which is again usually used for, for drug testing specimens. All right. Again, drug testing specimen, dito na pala. Pila ang iyahang ml, dapat 30 to 45. And again, ang volume is 60 ml container capacity. Ang capacity sa container, 60 ml. And again, ang temperature, on say range, 32.5 to 37.7 degrees Celsius. And it should be checked within 4 minutes. Naku, take note of that, dears. Sana pag gayaw-yaw ako dito, I'm sure, I hope, ani na part, gano'n na mo, like, okay, yes, sakto, I remember. Okay, nana, like, checking na lang. Charot. Next, glucose reabsorption, of course, happens in your PCT. Active transport of sodium, you have PCT, DCT. Passive transport of sodium, you have ascending loop of Henle. And impermeable to water, of course, we mentioned that ascending loop of Henle. Highly permeable to water, but poorly permeable to solutes, you have the descending loop of Henle. And what is the SG of the fluid leaving the glomerulus? Of course, that's your 1.010. All right, so our question dito is the SG of the glomerular filtrate, is 1.010. Purpose staining, of course, in catheter bags, of course, according to Strassinger, Kleb, and Providentia. All right. Specific gravity is influenced again by the number of particles and the size of the particles. And take note, it's not only the number, okay? Because ang osmolality, number yun. Wala rin appeal ang size. Pero for specgrav, it's both number and the size. Alright? So again, take note, ato ang mga corrections, o naka-table na dyan. Refractometry, or also as the total solids meter, you have kung distilled water, again, 1.000. For 3% NaCl, di ba, 1.015 plus and minus. 0.001, and then 5% NaCl, 1.022, and 9% sucrose, 1.034. So take note, magkataas imuhang SG, magkataas kung imong concentration sa imong gigamit na calibrator. And for every 1 gram of DL of protein, you subtract 0.003, and for glucose, every 1 gram per DL of glucose, subtract 0.004. All right? That's for refractometry. It's calibrated na for temperature. Okay, imuhang for refractometry. So you don't need to correct for temperature. For urinometry, dears, take note you have to correct for temperature and glucose and protein. Take note. Baka mag-ibo mo ng calibrated. I-change na lang. It should be calibrated for temperature, glucose, and protein, ang urinometry. But for refractometry, kailangan na kamo-calibrate for protein and glucose. Alright? So take note of that. Okay. Next, frequency of sound wave. Basta sound wave. There's a change in proportion to density of solution, of course, harmonic oscillation densitometry. So pangitaan na, basta sound wave, it's talking about sound, no? Harmonic, ayan. So go sa choice na harmonic. All right. Storage of reagent strips, of course, room temperature, 30 degrees Celsius and below, but never refrigerated. Take note of that. Next, protein produced by renal tubular epithelial cells. You have tam horsefall protein, or also known as your uromodulin. Okay. Next, of course, SSA grading. Nako, alam niyo na yarn. Okay, na-mention nato na. So, of course, ang grading, ayan. So, we'll start first with negative, no increase in turbidity. Your trace is noticeable. Pagabot sa 1 plus, you only have one characteristic, turbidity ra po. Pagabot sa 2 plus, mapunan, turbidity and granulation. O, diba? Turbidity and granulation. So, 2 plus, duha po niya ang characteristics, turbidity and granulation. Next, turbidity, granulation, and flocculation, tulo na kabuo. So, therefore, it's 3 plus. All right? And 4 plus, large clumps of protein. Okay? And then for protein range, take note, it starts with 6, then 6 to 13, 30 to 100, 100 to 200, 200 to 400, and then greater than 400. Okay? So, again, at least the description here, or sa turbidity, na description, natay mnemonics for that. No? Kung 1 plus, usara po niya ha, characteristic, turbidity. Kung 2 plus, duha po, turbidity and granulation. Okay? Then 3 plus, tulo po, turbidity, granulation, and flocculation. Diba? Alright. Okay, sige. Next, Benz-Jones protein. Of course, this is a abnormal antibody, no, ng mga light chains. Alright, again, sa iyang characteristic, it coagulates at 40 to 60 degrees Celsius and dissolves at 100 degrees Celsius. So take note of that. So basta nipa-ask mo, which of the following is false about the Benz-Jones protein. So take note again, it's made up of light chains, either kappa or lambda. Okay, either kappa or lambda. Take note. Second is of course iyahang principle, iyahang characteristic, precipitates or the solution becomes cloudy at 40 to 60 degrees Celsius and becomes clear at 100 degrees Celsius. All right, take note of that. Next, you have the principle of Micral test. Of course, is enzyme amino acid. That's a Micral, yeah. Microalbumin, diba? Determination that is using test kits. All right, Micral. Next, for creatinine, in cases na i-compare mo siya with albumin, iyang purpose or iyang principle is pseudo-peroxidase activity of copper creatinine complexes. In a way, same siyang principle sa blood, all right? Pero instead of hemoglobin sa blood, sa creatinine kay copper creatinine complex. So, yung creatinine sa ihi, mo bind sa copper, sa reagent, and this complex becomes or functions as the peroxide or peroxidase. Okay? All right. So, nasa yung peroxidase-like activity. All right. Next, of course, mga tablet composition. Ayan. So, ako na siyang i-summarize dira. So, ako na po yung appeal later sa katong notes na, katong summary. So, clinic test, of course, you have copper sulfate, sodium carbonate, sodium citrate, and sodium hydroxide. For acid test, as you can see, nasa lactose. And for ecto test, nasa SSA, sodium carbonate, and boric acid. Kaya basta na yung mga question na the following is the composition of your acid test tablet except acid test tablet composition 1, 2, 3, 4, ganun. Or clinic test tablet composition except ganun. So, mga questions in analysis. Okay? So, you have to take note sa composition. Next, how to remove the interference in ecto test. You may flush water, no, to the mat after urine is added para mawala itong mga interferences, especially sa drugs. Alright? 42, sodium nitroprusside is sensitive to acetone kung sa i-add glycine. Take note. So kung wala glycine, medyo dili ma-detect ang acetone. Because again, kung sa gina-detect ra sa imuhang reagent strip for ketones, kung sa na ketone body, your acetoacetic acid or AAA. Tulo na siya ka A. Or some, basin mo yun, tapos diacetic acid. That's the other name. Alright? So baka dili ihatag ang acetoacetic acid, ang ihatag kay diacetic acid, it's still the same. Alright? Okay. Pero which is the most abundant ketone body in the blood or in your urine? You have, what's my answer? The most abundant is, okay, the beta hydroxybutyrate. Take note of that here. Beta hydroxybutyrate 78, no? 20% is your AAA, and then 2% is your acetone. Check ko ba akong percentage? Baka nagkamali ako. Speckled pattern, of course, ay mukhang reagent pad for blood is your RBCs, no? Presence of RBCs. Because pag contact sa RBCs, intact RBCs, ay mukhang pad, mulize siya. That's why na siya speckled or mottled dotted pattern. Spotted pattern, basta mga dots. Speckled, spotted, mottled, dotted pattern. Okay? Sa imong blood na reagent strip or reagent pad that is for RBCs. Okay, all right. Next, you have your color reactions. Ayan, of course. Kinsa may positive, kung say positive result for bilirubin, pink to violet. Take note of that. So, kinsa itong mga reagent parameters na violet ang color, you have BKL, bilirubin, ketones, and leukocyte esterase. Again, siya mnemonic, BKL. Or di ba, katong i-share, bakla na gusto ang violet. Pero wala ay letter A. So, BKL, na gusto ang violet, you have bilirubin, ketones, and LE. And of course, you have pink, PUN, no? Pink, UN. You have uro and nitrite. Okay? Pink, uro, nitrite. False negative for formalin, you have BU, blood and urobilinogen. False positive reactions by formalin, you have leukocyte esterase. So kung false negative, BU, all right? And then kung false positive sa formalin, LE, leukocyte esterase. And again, of course, parameters affected by ascorbic acid, it being a strong reducing substance causing false negative reactions on these parameters. Kinsa ni sila? Bibilang. Alam nyo na yan. Take note, blood and bilirubin dapat greater than 25 mg per deal of ascorbic acid para siya mo interfere. Next, you have LNG, LE, nitrite, and glucose. BB lang. Alright? Take note, BB lang. Now, reporting. Okay, ayan. At ang mga mnemonics dyan. Number 1, average per 10 HPF. Okay, average per 10 HPF. What's a mnemonic? ROAR. All right, ROAR. Okay, ROAR, RBCs, oval fat bodies, WBCs, and RTE cells. Take note, ROAR. Okay, ROWR. Next, you have average per 10 LPF, cast crab. Okay, kung saan ang cast crab? Casts and abnormal crystals. All right. Next, you have RF MoMA, rare, few, moderate, many per 10 HPF. You have the Tata Bayan, okay? Or the wholesome, you have letter T by twice, TT, all right? TT Bayan, okay? All right. Trichomonas, transitional epithelial cells, bacteria, yeast, and normal crystal. Girl, oh my gosh, okay. RF MoMA, rare, few, moderate, many per HPF. You have TT Bayan. Okay. Next, you have RF MoMA per LPF. So you have mucous sex. You have mucous threads and squamous epithelial cells. All right. Okay, all right. Sige. So how do you remember this? If magbibog mo, remember, i-examine ang sediment or i-think ang sediment. So if dako siya, so na siya sa LPF. Pero if gagmay, na siya sa HPF. So therefore, WBCs, oval fat bodies, RBCs, crystals na normal, lagi siya sa HPF. Pero ang abnormal crystals, sa imo siyang LPF quantity. Okay? So ito na mga dagko na sediments, you have cells, no? Mga squamous epithelial cells, mga casts, mucus, dito na siya sa LPF. Okay? Remember, mga dagko na cells. No? So, they're also known as organized sediments, di ba? Organized sediments are those na mga cells na to. Ang unorganized sediments are the crystals. Okay? Take note. Kaya ang mga crystals man they are mga geometric shapes. They can assume a lot of shapes po pwede. Whereas your organized sediments, your cells, no? They're usually intact ilahang shape. Okay? So take note of that. So organized sediments are the cells. Ayan. And for unorganized, you have your crystals. Okay? So take note of the mnemonics. There's very important. I'm sure baka may reporting na lumabas bukas. Take note of the mnemonics. Basta average per 10 HPF, ROAR, RBCs, oval fat bodies, WBCs, and RTE. Average per 10 LPF, the casts and abnormal crystals. Cast crab. RF MoMA per HPF, you have the Tata Bayan. TT Bayan. Alright? Okay. And then you have RF MoMA per LPF, you have mucous sex, mucous threads, and squamous epithelium. And here example of microscopic breeding. Again, you have numbers, take note, no? So far, base na yung mga questions na 5 crystals or 5 epithelial cells seen per LPF. Kung saan siya pag-report. Is it rare? Is it few? Is it moderate? Is it many? 200 bacteria seen kung saan siya. Or 205 bacteria. Okay, so in cases lang ng Analyte, may mga overlapping pares ani. Okay, so just look at the choices. Ato na lang mo sa next na stage. Next na stage, so like example 50, ang answer na lang kay moderate. Okay? And then kung 200 prayers na lang. Charot. Tsaka lang. Hopefully wala rin na questions sa magawas. But in case, be familiar or memorize lang yun ang kaning numbers. Okay? Yung grading. Alright. Next, different appearances of your RBCs and WBCs. Of course, in hypotonic urine, your RBCs will lyse, okay, and they become ghost cells, all right? Next, for WBCs and hypotonic urine, again, they will glitter. You have glitter cells, okay? Because they will absorb water, all right? And the crystals will exhibit Brownian movement, and they will shine, shimmer, and be splendid, okay? Shining, shimmering, splendid, your glitter cells, okay? Ghost cells, nako, sino ba dyan? Charot, tsaka lang. Okay, all right. Next, lipid-containing RTEs, of course, you have bubble cells. Lipid-containing RTE cells, of course, oval fat bodies. Kung non-lipid is your bubble cells. Okay. Volume of sediment for examination, 20 microliters. Covastain, as you have mentioned, is the commercial brand of your Sternheimer-Malbin. Okay. Covastain or steady stain, ayan. Sternheimer-Malbin is again composed of your gram stain ng mga reagents. Okay. Crystal violet and safranin. Okay. Next, you have identifies urinary eosinophils, of course, Hansel stain. Eosin Y and methylene blue. So, muna siya bright stain, di ba? Basta Hansel stain, gani basta Hansel, it's for eosinophils. That next differentiates WBCs and RTEs, of course, toluidine blue. All right. For microscope, basta mga low refractive indices, phase contrast, such as mga casts. All right. So take note. Pero ang next ani is kung crystals, ayan, crystals and lipids, polarizing microscopy. All right. Dysmorphic RBC closely associated with glomerular bleeding. You have acanthocyte. All right. Your acanthocyte or your bursa, tama ba? Or spursa, whatever, basta acanthocyte. Okay? All right. Next, eosinophils in your urine. In cases of drug-induced interstitial nephritis, it is again considered significant if greater than 1% of the total WBC count or differential count kay eosinophils. So example, greater than 12% or nabot siya 2%, so that's significant. Squamous epithelial cells covered with Gardnerella, Phocobacillus, of course, it's your clue cells, and it's one of the significant na squamous epithelial cell. All right, the clue cells. Rectangular shape na RTE, it comes from the proximal convoluted, and round or oval, it comes from the distal convoluted. So take note, ang proximal kay columnar, iyahang mga cells or rectangular, and then for round or oval, it's from the distal. And then cells from the collecting duct that appear in groups of 3 or more renal fragments. And if cuboidal ang shape sa RTE, it's from collecting duct. So kung letter C, cuboidal, letter C po siya gikan, collecting ducts. Alright? Maltese cross formation, alam niyo na yan, that's in cholesterol. For cholesterol, most common fecal contaminant, ova of P. vermicularis. Only elements found in urine that are unique to the kidneys, casts. Formation at the junction, and nasa tapered end, remember siya ni niwang, then nasa ipog, that's your cylindroids. Same significance with your casts. And again, the presence of urinary casts is your cylindruria. Now, order of cast degeneration, di ba? Formation, it starts first with hyaline, which is the prototype, the beginning, di ba? In the beginning, there was a hyaline cast, okay? So, hyaline followed by ma-incorporate ang different cells, cellular. Then, after some time, mo degenerate ang cells, of course, so, may mo sa siyang rough ang appearance. Ay, baliktad di siya, dears. Sorry, baliktad ni. Coarse ni dapat una, sorry. Coarse granular, and then followed by fine granular, and then lastly, waxy. Paki-edit na lang. Ano rin ako na-edit? Pasensya. Please be with you. Alright, so hyaline, in the beginning, there was a hyaline cast incorporated by the different cells found in the tubules, cellular cast. And then, of course, the cells will degenerate, become coarse muna, and then becomes fine granular, and then lastly, may mo siya, wax. Okay? Now, representative of extreme urine stasis, you have waxy cast, renal failure cast, broad cast. But again, di ba, based on itong discussion sa microscopic, depende siya sa reference because according to Brenzel, ang iyang waxy cast ang renal failure. But for Strasinger, it's broadcast. So, if mo gawas tomorrow, kung sa matong i-answer, prayers. So, look na lang sa choices. Hopefully, dili sila mo gawas ang duha. Alright? But, sige lang, if ever mo gawas ang duha, pwede na ako mainan silang Ma'am K if ever, kung silang answer, no? But siguro, most likely, ilahang gigamit is Strasinger. Okay, so, answer na lang broadcasts. Okay? If ever. But hopefully, hindi mo gawas ang duha. Okay? Sana naman. Alright? And hindi po mo gawasin na question. Okay, alright. Now, precipitation of crystals, ang say mga factors, of course, pH, temperature, and solute concentration. So, of course, we have mentioned that there are some crystals na ganahan ng acidic and or alkaline pH. Temperature, of course, usually low temperature, it will facilitate the precipitation of crystals in your urine. That's why after refrigeration, dito mo precipitate ang imong mga crystals or during refrigeration. Solid concentration, of course, if taas kaayo, no? Iyahang concentration or taas kayahang concentration gani sa solutes, it will supersaturate and precipitate siya out of the solution and become crystals. Okay. Next, you have highly variable. Ayan, as I mentioned, the most pleomorphic among the crystals, you have your uric acid. And again, lemon shape. All right. Ethylene glycol poisoning, monohydrate caox. Kung say other name ni monohydrate caox, it's a siya. Say other name?
Light.
Light.
The Wewelite. Take note, how do we remember, di ba? Wewelite is monohydrate. Wedelite, katulad ng letter D, siya ang dihydrate. Okay, very good. And among the two, ang pinaka-common is, of course, dihydrate caox. Alright. Colorless nidos, then will form of bundles after refrigeration, ampicillin. Flat rectangular.
Sir.
Yes.
Nay question si Jebs.
Okay, Jeff. Yes, Jeff.
Sir, kaning sa number 77 dito, sir. Kay nakabutang sa imong notes dito, sir, na ang extreme urine stasis kina sa broadcast.
The broadcast yapo, no? I think, baka parang nagkamali na naman ako. I think ibang reference ako nabutang dito, dears. So usually, basta, you have to take note lang na ang waxy and broad, pwede na dito sila same yun na urine stasis, no? Siguro, if mugawas ang question ay Ana, let's go na lang for broadcast, okay? Pero both of them pwede na yun na ma-answer, okay? So yeah. Actually, paglato na ako na nakikibutang nalain dito sa akong gihatag ninyo. So pasensya. But again, if ever magani, pwede na yun broad or waxy. Depende sa references actually. I think ang Brenzel, ni-mention siya na waxy is also for extreme urine stasis. Because after, ang waxy manggod is, di ba, the last stage ng liver cast. Ang broad manggod is just talking about size, no? So, ang waxy, dito na ang end niya. But again, if intense pag yun, kung magpadayon pa, pwede siyang mo increase in size, muna siyang mahimo siyang broad. Okay, so the broad cast in a way, it could be waxy or other types of casts. Pero, again, broad, pinaka-common yun is the last two stages na lang, granular and waxy. So, in a way, we're na overlapping of but sige lang. Hopefully, di na magawas. Pero stick na lang mo with Strasinger, okay? Kung sa dimension. I think ang dimension sa Strasinger kay broad, ang extreme urine stasis, no? Am I right? Sa Strasinger?
Yes, sir.
So broad na lang, okay? Para safe tang-tangan. Okay? Alright, sige. So pasensya sa confusion.
Thank you, sir.
Alright. Thank you po, Jeff. Next, you have yellow-brown, occasionally colorless. Ayan, na mga crystals, dears. And take note, sheaves of wheat. Alright, rosettes, nidos. What you have to remember, dears, confirmed by diazo reaction. So, ang nidos daw kay sheaves of wheat, rosettes, tapos meron nidos, and confirmed by diazo, nako. Okay, that is for, kung sa ato ang answer, Ana, you have sulfonamide crystals. Take note of that. Okay, next you have apatite. Again, sa other name, you have calcium phosphate. Kato mga brushite, mga hydroxyapatite, basta ka na siya, that's calcium phosphate. Wedelite, as we mentioned, letter D, kinsay daghang letter D, dihydrate. Wewelite, letter M, yes. Ang W, ani, pwede mo siyang mabali, mo siyang letter M. So, complicated na. Basta remember lang na kung kinsay daghang letter D po siya. So, wedelite, dihydrate. So, therefore, ang wewelite is katong usa, monohydrate. Struvite, of course, is your triple phosphate. Take note. Magnesium ammonium phosphate, again, infection with urea, splitting bacteria, especially Proteus. Okay, Proteus. Next, you have renal calculi may form in the calyces and pelvis of the kidney, the ureters, and bladder. So, dili na siya sa kidneys, pero pwede siyang mabot sa ureter and sa bladder. Alright? Calculi described as yellow to brownish red, moderately hard, that's uric acid, na stone. Calculi na pale and friable, you have phosphate. Calculi na very hard, dark color, and rough na surface, you have caox. And you have calculi na somewhat greasy or masyag soap, you have cysteine. So, namoy, sa TOS, meron 2% na calculi. So, baka ganito yung question, no? Mga description sa calculi. Alright. Krustalsine and Fanconi syndrome, of course, you have cysteine because Fanconi syndrome is defective tubular reabsorption of substances. Appeals si cysteine ato. And pwede siyang accumulate and cause cystinuria, di ba? Ayan. So, pwede siyang precipitate as cysteine stones. Next, you have staghorn calculi, triple phosphate. Take note, masyag antler sa deer, okay? Triple phosphate. Next, you have ANCA, anti-neutrophilic cytoplasmic antibody, of course, Wegener's granulomatosis. Na ANCA, letter C, So GC. No, CWDI, dito na ako remember. Anca Wegeners. Okay. NADI, anti-glomerular basement membrane, letter G, anti-glomerular, letter G po, good pasture. Okay, so anti-glomerular basement membrane, anti-G, glomerular basement membrane, unsa siya na disease, letter G, good pasture. Okay, anti-neutrophilic cytoplasmic antibody, ANCA is for Wegeners, granulomatosis. HLA-B2, HLA-B12, sorry, asa siya associated na disease, minimal change disease. Alright. Heavy proteinuria, ayan, na-mention na nato, massive proteinuria, massive lipiduria, kinsa kanina na siya na disease, nephrotic syndrome. Press the buzzer. Again, heavy proteinuria, heavy lipiduria, appearance of fatty casts, appearance of oval fat bodies, cholesterol crystals, hypoproteinemia, gamay mo ang albumin, hypoalbuminemia, alam niyo na yan, that's nephrotic syndrome. Okay? 100 inability of the renal tubules to respond to ADH. So, ang tubules ang problema, you have nephrogenic. Inability of a failure of the hypothalamus to produce ADH, you have neurogenic. Alright? A procedure using high energy shock waves to break stones, ayan, in the upper urinary tract into pieces that can be passed in the urine, of course, lithotripsy or extracorporeal shockwave lithotripsy. Okay? Lithotripsy. Mugamit kang shockwave para mabungkag ang stones into smaller pieces na pwede nang maihi. Alright? Ayan, sige. Next, you have mga dears, mga metabolic disorders, but I hope nila mo gawas. But again, remember, tests for the presence of porphobilinogen, the HOESH test. We discussed this sa urobilinogen, di ba, na chemical strip. Increased porphobilinogen is acute intermittent porphyria. So mga porphyrins, no? You have the handout there. Pwede mo ano-ano. Basta, as I mentioned, memorize lang mo. You have to remember the enzymes, no? And all that. Pero I think, wala man sa TOS, so basta hindi na siyang gawas. Herder, Hunter, and Sanfilippo are mga mucopolysaccharide disorders. For Herder and Hunter, as you can see, nasa mental retardation and abnormal skeletal structure. But for Sanfilippo, only mental retardation. Alright? Watson-Schwartz, dako ayan. Sige, ito na siyang i-drawing. Okay. Oh my gosh, hindi pa mo akong dears. Ako ang whiteboard. So again, Watson-Schwartz, di ba? Atong buhaton is usually this is for the differentiation of a red urine. Okay? So atong buhaton is, di ba? You use butanol and chloroform. Right? So you divide the tubes into two, di ba? You have here duha ka pairs. Di ba? How do we remember? Ang butanol kay, although letter B siya, pero siya ang top, di ba? So B, U, so that's the butanol na tube. And the other is the chloroform tube. Si chloroform ang bottom. Okay? So C, U. U stands for urine. Okay? So, oh my God, di na siya maklaro, Mark. Okay, sige. So, ayan. BU. Okay? So, take note of that. Hindi na maklaro na may ink ako ang whiteboard marker, dears. So, pasensya. Alright? Ayan. Okay. Basta, butanol. Okay? Butanol, siya ang top. And then urine sa ubos. This is the butanol tube. And you have the chloroform tube, chloroform sa ubos, urine sa taas. Okay? Alright. So, depende na siya sa solubility sa mga substances. So, for both layers are red in the two tubes, present ang uro and porphobilinogen. Pero, soluble in both butanol and chloroform, meaning, red siya sa butanol, red po siya sa, tama. Red yung mga butanol, taas, okay? Red po ang sa chloroform, that is urobilinogen, okay? Pero, insoluble, meaning hindi siya ma-dissolve sa imong butanol and chloroform, meaning red ra dire sa urine, and then red ra po dire, then that is porphobilinogen, okay? So, again, na-discuss natin na dears ha, medyo, hindi na ako ma-drawing akong whiteboard marker, wala ko yung ink, di ay. And then, soluble only in butanol, alright, is your Ehrlich reactive compound. So, take note of that. I think, mugawas din na siya. So, sa Watson-Schwartz, no? So, base ng question, butan dito kay, the tube for chloroform, ayan, the tube for chloroform, para sa ani, kay red daw sa ilalong, ayan, red daw sa ilalong na layer. So, meaning, red siya sa chloroform, meaning soluble siya sa chloroform. And then, gibutan dito na the butanol tube, red po ng upper layer, o di ba? So meaning, na-extract siya or soluble siya sa butanol. So kinsa man ang soluble in both butanol and chloroform, you have urobilinogen. Okay, so inana. Sa Watson-Schwarz, basin na ng question. Okay? Alright, so take note of that. Okay, sige. Okay. So we go now to the other body fluids na lang. Yan, very short na lang, other body fluids. You have CSF, of course, CSF tube 1 para kakinsa, you have chemistry and serology. And again, take note kung sa iyang mga storage temperature. Your chemistry is frozen or serology frozen. Tube 2 is kept at room temperature for micro. And then you have, for third tube, you have hematology, which is, yeah.
Pwede ko pausap again.
Ang sa?
Pausap mi again sa katong Watson-Schwarz, sir.
Okay, Watson-Schwarz, sige. I knew it, sige. Mangita sa word there, son. Teka lang. Kalma lang. Sige, let me breathe muna. Kaya wala ko'y whiteboard marker na extra. Basta, di mo siya maklaro. Okay, sige, wait lang ha. So, ang ano sa Watson-Schwarz dears, sige. Oh my God, akong Watson-Schwarz. You have, alright. So, you will make 2 tubes. Ayan. Ako saan lang i-off ang ring light para magka-isa. Maklaro na? Or di? Mark, ano sabi na yung, okay, wait. Teka. So, dapat dili siya dati. Maklaro dili? Dili. Or, kaya lang. Maklaro dili.
Para na sir.
Okay. So, ang imo button sa Watson-Schwarz dears is you have a red urine. Okay? You have a red urine, you want to determine kung sa'y cause. Is it caused by uro, porphobilinogen, or other early reactive substances? Especially that sa mga reagents that for urobilinogen, pwede mo react ng mga other early reactive substances. So what you do is imong ihi, alright, na red, imo siyang i-distribute into 2 tubes. Okay? And each tube imong butangan og reagent. 1 tube is for butanol, ayan, and the other tube is for chloroform. Okay? So pag-add mo ana, of course, mo form og layers. Okay? Ayan. So therefore, ang layers ani na ma-form, ayan. Kumapit ka dyan. Oh my God, whiteboard marker. Huwag na yung layers. Huwag na ko extra. Oh my God. Okay. So butanol and chloroform. Okay? Ayan. So, of course, sa butanol na tube, dears, okay, di ba? Nakabutang na taog urine and butanol. So, atong natawag ang layers na ma-form. Okay? So, ang layers na ma-form sa butanol is, kata kong dimension, sa letter B, although letter B siya, pero siya ang top. So, na siya sa upper layer. Ang nasa ubos na layer is urine, letter U. Oh my goodness. Oh my God. Girl, saan na ako ni? And then, you have, wait. Mukha na lang sa ako marker dears, nakakonfirm na. Ako lang i-erase later. Wait. Teka. Okay, alright. So, pasensya dears. So, permanent marker na lang dito, ani. Wala ko pa atong AK na para mag-refill. But anyway, ayan, sige. So, balik no? So again, this is the layer formed sa butanol. Alright? So, sa letter B, siya ang nasa taas. Alright? And sa ilalong si urine. In contrast, si chloroform na layer, okay? Chloroform na layer, ayan. Si chloroform now ang nasa ilalong. So, siya si bottom, okay? Ayan. And ang U nasa taas, urine. Okay? Take note. Nagets lang. So this is the layers formed after addition sa butanol and chloroform sa imuhang urine. Okay? Now we go now to the expected results. Alright? So if red ra ang upper layer, meaning soluble siya sa butanol, and red ra pud sa chloroform, meaning soluble siya sa chloroform, that is characteristic of kinsa man, urobilinogen. In contrast, if red ang upper layer, urine, okay, and red pod ang lower layer sa butanol, then kakinsa man na siya. Meaning, hindi siya soluble sa both butanol and chloroform, that is porphobilinogen. And you have also last, red lang siya sa butanol layer, okay, upper layer, okay? And then, red po siya sa upper layer sa chloroform tube, okay? So meaning, wala siya na-extract sa chloroform sa ilalog, that is, kakinsa man, early reactive substances. Basta if pasabot na red gears, meaning dito siya na-extract or soluble siya dito. Okay? So, that's the point. So, example, like question dito, in the butanol tube, ayan, in the butanol tube, the upper layer is color red. Okay? Okay, muna siya. Next, in the chloroform tube, the lower layer is color red. So, kitsa man na siya. You have, kitsa man to, na description. You have, katinsa to. Okay?
Urobilinogen.
Urobilinogen.
Very good. Take note of that. So, basta kung ang point kay kung asang color red, meaning dito siya soluble. So, meaning, if nara siya diri sa urina layer, and nara siya sa urina layer ko diri, meaning wala siya na-extract sa mga reagent. Okay? So, let's say, given ka, question na po, in the butanol layer, okay, there is, in the butanol tube, sorry. In the butanol tube, the upper layer is colorless. The upper layer is color red. Ayan. The upper layer is color red. In the chloroform tube, alright, the upper layer is color red. Okay? So, kitsa man to. Imuhang upper layer sa butanol tube kay red. Imuhang upper layer sa chloroform tube kay red. So, kitsa man to. You have other early reactive substances. Meaning, sa butanol ra siya soluble, dili siya soluble sa chloroform. Last na lang yun. In the chloroform, in the butanol layer, the lower layer is color red. And in the chloroform layer, the upper layer is color red. Kakinsa man ni? This is?
Urobilinogen.
Very good. Meaning, wala siya na-extract sa both chloroform and butanol. Alright? So I hope na-gets na. Okay ra? Na-gets na? Or any question? Karina? So Watson Schwartz? Okay? Okay na? Or any questions? Carry pa?
And ako question, sir.
Yes, yes.
For example, so kung dili siya ma-extract, sir, for example, kaning sa butanol kay red ang bottom, tapos sa chloroform kay red po ang urine. So ang expected ana sa top is colorless or other color?
Yes, colorless lang. Kaya meaning,
Okay, sir.
Meaning kung asa tong red, meaning na dito tong substance. So na dito si 4,4 si euro. So if dili siya ma-extract ani na solvent, colorless na siya. Okay? Alright, so
Thank you, sir.
so basahin nyo, take note lang kay color red. Or baka kayo nato ang question, ipahinga na siya ba, like, i-change na to, like, let's say, the butanol tube, ayan, the butanol tube, ang imuhang lower layer kay color red, okay? Sige. The lower layer is color red, okay? In the chloroform tube, the lower layer is colorless. So, unsay pasabutan na? Kinsa man na siya na substance. I-change na ko ha. Let's say, butanol, in the butanol tube, okay, the lower layer is color red. Okay? In the chloroform tube, the lower layer is color red. Sige, kinsa man na siya na substance.
Color red ang chloroform, sir? Or colorless?
Sa chloroform tube, okay, as mentioned, color red sa lower layer or dito sa bottom layer. The bottom layer is color red sa chloroform tube, and sa imuhang butanol tube, color red po sa imuhang bottom layer. So, kakinsa man na. I joke, sorry, mali. Again, sorry. Butanol tube, red si bottom layer, okay? Chloroform tube, okay? Colorless si bottom layer. Kakinsa man na.
Porphobilinogen.
Okay, very good. So, porphobilinogen. Nga naman, kay colorless diri sa bottom layer. So, you're expecting ng upper layer kay color red. And di ba, ang imuhang porphobilinogen, hindi siya ma-extract sa imuhang chloroform. Okay? So, take note of that. So, you have to remember lang the order of kaning, kung kinsay upper, kinsay lower. Okay? So, sa butanol tube, again, nasa taas si butanol, ilalom si urine. Okay? And for the chloroform tube, nasa taas si urine, chloroform ang nasa ilalom. Okay? Alright. So, I hope na-gets lang to siya. Okay. Any questions, Karina? Or nasabtan ng Watson Schwartz? Okay?
Yes, sir.
Okay, sige. Alright. So, yes, mag-ano na tayo ni. Mangita na tayong space for the Okay, permanent markers. Okay, all right. Anyway, CSF, okay, na-mention na to. Of course, the 3 tubes, 1, 2, 3, of course. If na extra na 4, it's for micro or serology. Take note of that, peers. Okay. Now, diluents, kung total cell count is NSS, CSF WBC, you have acetic acid with methylene blue. And of course, mention na to atong dilutions depending on the appearance. You have again, 1 is to undiluted kung clear, slightly hazy, 1 is to 10, 1 is to 20, 1 is to 100. 1 is to 200 and 1 is to 10,000. So, kaya siya focus for CSF ni siya years. Okay? Kung i-specify ko na CSF, kung siya follow. But for Brenzel, katong na-mention, di ba? There are some other dilutions po dito. Okay? But kanina sa Strasinger, kanina sa ato i-follow. Alright? So, kaya i-specify ko siya for CSF. Okay? Ayan, sige. Now, classic starburst appearance in your gram stain, you have Cryptococcus neoformans. Okay? Or, if ever, India ink, di ba? Halo appearance, you have Cryptococcus neoformans. Increased eosinophils sa CSF, kakinsa na fungal infection, you have coccidioides immitis. Alright? Now, the course of multiple sclerosis can be monitored by kinsaman, myelin basic protein, your MVP. Now, take note your myelin basic protein, although it's not really specific for multiple sclerosis. Okay? But it can be used for monitoring. Okay. Whew. Next, you have of course CSF normal values. Of course, CSF protein 15 to 45 mg per dl. For CSF serum albumin index, less than 9 is intact BBB or blood-brain barrier. Greater than equal to 9, BBB is damaged, or katong natin ranges dito sa inyong notes. And 100 is complete damage to BBB. IgG index greater than 0.70, again indicative of IgG production, multiple sclerosis. Less than 0.70, no active production. CSF glucose 60 to 70% of plasma glucose. CSF lactate 10 to 22, and CSF glutamine 8 to 18. Greater than 35 mg per dl na glutamine, di ba? It can cause disturbances na in consciousness. Okay? Greater than 35 mg per dl na glutamine. All right. What can be added to CSF to increase cell yield? You have 30% albumin. But as I mentioned, according to Brenzel and Graf, 22%. Okay? Pero for Strasinger na lang, atong i-follow 30%. Okay? Latex agglutination test, basta Cryptococcus ganidires na kung na-mention, basta serological test sa Cryptococcus, especially for CSF testing, kung sige na-detect, antigen, cryptococcal antigen. Okay. Synovial fluid, of course, normal is 4 to 6 cm ang string, di ba? 800 WBCs per UN, unsa na siya, non-inflammatory. So, we summarize na ako ni, napon sa table ninyo, di ba? Kato, depende na lang kung unsay mas effective ninyo. Kanitin ani or katong di-separate siya sa inyong notes, kato mong discuss gahapon. Alright? Okay. Sige. Now, take note lang, again, inflammatory, crystal-induced, milky, iyahang synovial fluid, and crystals are present. Inflammatory, immunologic, autoantibodies. And again, septic, positive gram-staining culture, and highest neutrophil count. Okay, take note for septic because that's a bacterial infection. All right. Next, you have, of course, synovial fluid diluents, normal saline, all right, with methylene blue to stain WBCs. And to lyse the RBCs, again, you cannot use acetic acid. Okay, again, precipitate imuhang or muklap imuhang synovial fluid. To lyse the RBCs, sa pwedeng gamiton, hypotonic saline or saline with saponin. Okay? Cells and crystals in synovial fluid, gout, of course, monosodium urate, alam niyo na, yellow, negative birefringence, and pseudogout, you have blue, positive birefringence. Alright? LE cell, round body, Reiter cell, macrophage with ingested neutrophils. Rhagocyte dish or RA cell, take note na siya precipitated immune complexes or na siya rheumatoid factor sa cytoplasm. Take note. Rheumatoid factor sa cytoplasm or precipitated immune complexes. Rice bodies, macroscopic, polished rice grains. Microscopic, it can show collagen and fibrin. Take note, dears, na pwede siya makita macroscopically and microscopically ang imong rice bodies. Ochrotic shards, ground pepper. No? Pepper appearance in your cartilage, usually seen in ochronosis. And again, kinsa itong metabolic disorder na na ochronosis, possible ochronosis, kinsa to siya? You have, kinsa to? You have metabolic disorder. You have, okay, alkaptonuria. Take note. Alkaptonuria, the deposition of homogenetic acid. Next, you have serous fluids. Ato na-discuss din ng morning sa mga nag-join. Ayan. Fluid, blood, protein, and LDH ratio. It's the most reliable or the best reliable test to differentiate transudate from exudate. Okay, take note of that. Again, when we say transudate, there is a difference or there's a problem in pressures. Okay, so nag-leak ang fluid padulong sa cavity because of differences in pressure. And for exudate na ay vasodilation na hitabo sa capillaries because of infection or inflammation and nag-release siya mga fluids sa cavity. Okay, so take note, appearance of milky, chylous or pseudochylous. Again, unsay best test to differentiate chylous or pseudochylous, your triglyceride. Take note, fluid, blood, triglyceride ratio. Mas daghan sa chylous compared sa pseudochylous. Again, chylous effusions, there is thoracic duct leakage. So, nag-introduce kag lymphatic fluid sa imuhang cavity. So, therefore, taas ng mga lipids and fats. So, daghang triglycerides, no? And for pseudochylous, take note, positive siya cholesterol. Okay? So, pero if ang test ang panguntanon, unsay best test to, the best method to differentiate chylous from pseudochylous, you have the fluid-blood triglyceride ratio. Take note. Presence of blood and pleural fluid, pwedeng hemothorax or hemorrhagic effusion. If the fluid hematocrit is greater than 50% of the whole blood hematocrit, let's say, again, your fluid hematocrit is 35, press ganina, fluid hematocrit. Okay, so ang ipag-release ani. And then, let's say 50% yung blood hematocrit. Alright? Ayan. So, para sa ani, no? Fluid hematocrit, ayan, is 35% compared to your blood hematocrit na 50%. So, 1/2 of 50% is 25. So, ang fluid hematocrit, if greater than 1/2 of the whole blood hematocrit, then that is hemothorax. So, in this case, 35% man ang fluid hematocrit compared to your 1/2 of the blood hematocrit, which is 25%, diba? Kay 50 man, okay, 1/2 is 25. So, fluid hematocrit is greater than your whole blood hematocrit na 1/2, then that is indicative of hemothorax, okay? And if it's less than, okay, then that is hemorrhagic effusion, okay? All right. Next, you have cells seen in pleural fluid, of course, neutrophils, lymphocytes. Strongly positive na din. Sayop ni siya, strongly positive, don't, sayop na siya. Na tayo po, okay, neutrophils and lymphocytes. ADA, of course, adenosine deaminase, basta greater than 40 U per L, that is indicative of tuberculosis. Peritoneal fluid or acidic fluid, of course, cirrhosis ang frequent cause of acidic transudates. Peritonitis due to perforation and ruptured appendix, the most frequent cause of exudative fluids. I think gikan sa Strasinger gyapon. All right? So cirrhosis, again, frequent cause of acidic transudates, and peritonitis ang siyang cause sa exudates. Okay? All right. Peritoneal lavage, okay, this is used to detect blunt trauma or injury greater than 100,000 RBCs per UL. Okay? And for bacterial peritonitis, greater than 500 WBCs per UL. Yeah. Ako na i-layover, pero wala ko yung whiteboard marker. Muna siya akong problema sa pag-erase. Pero okay lang, sige lang. Napa may space. Okay, alright, sige. Yes, alright. Next, ginagmay na lang gears. Kapit na, I think last page na lang. Pero hima na sunod. Yes. Okay, so next you have Analyte Measuring OD 450. Take note gears, OD, yes. Yan, charot. Hiram naman ang asa. Tsaka lang. Analyte Measured in OD 450. Bilirubin. Take note there sa, take note, that's a common question. Which of the following is the analyte measured in OD 450 bilirubin? OD 450 is spectrophotometry. You measure optical density. And bilirubin, iyahang maximum absorbance happens at 450 nanometers. Okay? Take note. Lively graph is at the mga zone 1, zone 2, and zone 3. Zone 1, kay mild, HDN. Zone 2 is moderate hemolysis and requires careful monitoring. And zone 3, of course, siya ang pinaka-severe. Kailangan ng intervention. Pwedeng induction of labor or exchange transfusion. Alright? So that's for the Lively graph. Mga different zones. Take note, okay, basta ni-describe na. Moderate hemolysis requires close monitoring. What is this zone in the Lively graph? Press the buzzer, you have zone 2. Okay? Alright. Amniocentesis to detect neural tube defects, weeks, 15 to 18 weeks of gestation. And for amniocentesis to detect fetal lung maturity, FLM, and to detect HDN, kakinsa na, or kano sa siya i-perform, 24 to 40 weeks of gestation. Take note, 15 to 18, neural tube defects. 24 to 40, you have FLM, fetal lung maturity, and HDN. All right. Fern test, of course, to detect if amniotic fluid siya. So you put it on a slide, air dry, and then look for the presence of fern-like crystals. Fetal lung maturity test, kinsa na sila? LS ratio, lecithin sphingomyelin ratio. You have amniostat FLM, okay. You have also phosphatidylglycerol na test. Foam stability index, you have microviscosity test and lamellar body count, okay, LBC, and OD 650. Take note, lamellar body count, OD 650. So these are all the tests for fetal lung maturity. So basta na yung question dito, which of the following is a test to determine the amount of surfactants, ayan, that is needed or nasa yung fetal lung. Okay? Next, foam stability index or the shake test. Take note, unsay ato ang reagent, 95% ethanol or absolute ethanol. Take note of that. Na yung mga questions na Ana, again, what is the reagent used for the foam shake test? Okay? All right. Next, for feces, neutral fats, of course, it's stained with your Sudan-3. Orange-red droplets, greater than 60 droplets per HPF. That's indicative of steatorrhea. And for fatty acids and soaps, it requires acetic acid and heat, which is your split fat stain. The normal is 100 droplets per HPF, less than 4 micrometers ang size or diameter. Slightly increase 100 droplets of 1 to 8 micrometer na size, and increase by 100 droplets 6 to 75 micrometer. Increase in direct fat stain or kaning imuhang neutral fat stain, that is maldigestion. So, di ba? Increase ang first slide, that's maldigestion. And kung increased food ang imuhang split fat stain, that's malabsorption. Okay, so take note, kung increased ang first slide or increased ang neutral fat stain, maldigestion. Kung increased ang sa second slide or sa split fat stain, you have malabsorption. Alright? Invasive diarrhea, of course, greater than equal to 3 neutrophils per HPF. Again, unsay principle sa ito ang mga guayak-based fetal occult blood testing. Sa ganito, you have
Pseudoperoxidase activity.
Pseudoperoxidase activity of hemoglobin. So same principle lang with your urine. Alright? Next, blastomyces, mention na nato, bago lang, myelin globulus. Bronchial asthma, again, mnemonics, DCCC. Dietrich slug, Hirschman spirals, Charcot-Leyden crystals, and Crayola buds. Take note, there's 140, 141, this is automation, baka itanong, okay? So this is the stain used, no, by Sysmex ba to? Na machine, okay, to detect mga microscopic sediments. So, kinsa to mo stain sa DNA, you have phenacridine. And how do we remember? Kinsa na letter D, mo yang stain, no? DNA, phenacridine. Kinsay color? Orange, okay? And kinsa to mo stain sa nuclear membranes, mitochondria, and negatively charged cell membranes, you have carbocyanine, okay, which is color green. Okay, now mga medical legal tests for sperm, you have Florence test, again, test for choline. Okay, so FC, di ba? Positive dark brown rhombic crystals, and reagents, mga iodine and potassium iodide. And for Barbiero, di ba? Barbero, mag, shrimp, o leaves, no? So for test for spermine, yellow leaf shaped crystals. Okay, so Barbiero, mag, shrimp, o leaves. Okay, ayan. Okay, madungan pa ko, dears. Okay pa? Internet connection is unstable. Okay ra? Okay pa, dears? Can you hear me?
Yes, sir.
Alright, pasensya. Abin mo wala. Okay, alright. Okay, sige. Yeah, okay ra, Clay, no problem. Sige, na-shock po ko ako. Abas na peslitan. Sige na, no problems. Okay, so medical legal test sa, take note, Barbero, di ba? So, take alot. So, leaf-like na shrimp, okay? Ayan. Leaf-like crystals. Take note, our reagents, picric acid and trichloroacetic acid. So, ang Florence na lang is Italy, no? Florence, Italy. So, letter I po diya ang reagent. Iodine, no? Potassium iodide, no? O iodine. For Barbero, kay mga acids, no? You have trichloroacetic and picric acid. Alright. Now, sperm, of course, take note, acrosomal cap of the sperm, it should encompass 1/2 of the head, 2/3 of the nucleus. Take note there sa, I tell you, very common question yun na, unsay size or unsay ano sa acrosomal cap. So, acrosomal cap is 1/2, okay? 1/2 of the head, 2/3 of the nucleus. And as I mentioned, consistency. As in, kanin silang duha, igwas akong boards, basin mo gwas ko sa inyong exam. Watery, 0 watery, 4 gel light. 0 watery, 4 gel light. Hey, 0 watery, for gel light. Okay? 0 watery for gel light. Balik-balik kay. Balik-balik yun sa mind para di mo mahanap. Okay? 0 watery for gel light. 0 watery for gel light. 0 watery for gel light. Okay? Alright. Thank you, Sir Errol. Next, you have cottage cheese-like discharge as a vagina na deers. Wala na may labot sa vagina. But sige lang. Cottage cheese, candida, frothy adherent discharge, trichomonas. Special culture medium for T. vaginalis is diamonds. And you have a protein present in vaginal secretions that can identify patients who are at risk for preterm. So meaning, di pa siya dapat manganak, pero pwede na siyang manganak. Okay, or at risk na siya for early delivery, you have fetal fibronectin. But ay, wala may vaginal secretion sa inyong POS, so laban na. Alright, okay. Take note lang, basta clue cells, no? That's for your Gardnerella vaginalis, okay? And the whiff test, no? Sa inyong Gardnerella vaginalis. Okay, now stages of sperm maturation, gonia muna, spermatogonia, then duha ka spermatocytes, primary, secondary, followed by your spermatid, and then finally the spermatozoa or spermatozoon, okay? Next, you have sperm count is the sperm concentration times milliliters per ejaculate or the total volume. And for sperm motility, of course, alam niyo na yan, ang mga descriptions of 4, 3, 2, and 1. Okay? Alright. And sperm motility, di ba, we examine 20 HTF or 200 ka sperms. Take note of that. Alright? So that's all for you do notes. Okay? So, sa matunahon. Ato sa irasyo ang quiz or ang inyong kaning other questions pa. What do you think?
Excuse me, sir. Na ako question, sir.
Last day, Lenos, day.
Kaning sa consistency, sir, ba? Sa kanang sperm, wala siya like in between, sir? Like between sa 0 ug sa 4?
Yeah. Pwede siyang, ang ibutang na siya din kay, sa Strassingers, pwede ka mag-range from 0 to 4, alright? So of course, pwede siyang 1, 2, 3, pero wala nilang ibutang kung unsay description. Pero for Brunzel, mo differ daw siya sa laboratory. Kaya naiuban na, instead of numbers, ilan siyang i-describe as normal, slightly viscous, ganun. Okay? Pero for Strassinger, kani siya, wala po siya dimension. Igor ang 0 to 4. Okay? So, either watery or gel-like. So, 0 watery, then 4 gel-like. Pero,
Sige, sir.
Yeah. Pero I think, depende siya sa labs po sila pag-interpret. Okay? So, ganun. Alright? So, basta take note here sa, I tell you talaga, promise, mag-press the buzzer dyan ka, mag-praise the Lord. Hindi kumugawas. 0 watery, 4 gel-like. Diba? So, it's very easy to remember kaya nakay-beat na gigama. 0 watery, 4 gel-like. 0 watery, 4 gel-like. Okay? Alright, sige. So, sa itong unang irasyo, ang imuhang quiz or ang ato ang other questions. Ako sa stop of share. Okay. So, yung quiz na lang, or ano man, 30 items dito siya, no? So, baka matagalan tayo. But anyway, wait lang. So, sige, sa quiz na lang muna. Sige, I'll just preview the quiz. Sorry, I'll preview. Test na. Okay, ako na siya ikan yung quiz. Preview na rin. Kamusta niya ang quiz? How did you... Charot lang. Kamusta ang quiz? Or like, kung sa'yo mo medyo challenging ato na part. Tanan, sir. Kung sa'yo mo wala na ano dito. Malingkod ako dear sa akin, medyo sakit ako everything. Okay. So, unsa may murag na something sa quiz. Madungan pa ko? Can you hear me okay lang?
Yes, sir.
Okay. So, sa quiz, kamusta? Unsa may medyo murag wala kayo na gets or murag na syuket or unsa man. Case studies. Ang case study. Initial findings sa metabolic. Okay, sige. Atong i-share screen, akong i-share ako ang okay. So, alright. Sige. So, atong i-preview ang quiz. Alright. So, atong i-start attempt. Okay, question number 1. Please study pag na una. Okay, so a urinalysis performed with a 27-year-old female yields the following results. Alright, so ito lang tao ng mga M. Alright, sige. So you have SG of 1.008. So is that normal or dili? Oy. Normal ba ni or dili?
Yes, sir.
Okay, normal. pH of 5.0. Or madugay ta ani no. Tawa na. Kung unsa may mga abnormal na results nila. Okay, sige. Unsa may abnormal results nato?
Protein.
Protein and unsa man? Protein na ba? Blood. Unsa pa? Napa?
Lymphocytes.
Okay. All right. So you're left with that, no? You're left with that information. So it's abnormal ang protein, blood, and leukocytes. So makating nasa protein na po siya blood. So interesting. Okay, interesting. Okay, let's go to microscopic findings. At dito sa WBC, as you can see, daghan pong RBCs. Ang casts varied. You have hyaline, you have RBC, and you have granular casts. You also have crystals na moderate. Okay? So these findings are most consistent with, let's say again, balik ta, retract sa itong mga results. You have blood na 3+, protein na 2+, you have a lot of RBCs. Napad yung kay RBC casts. The presence of RBC casts indicates that there is glomerular damage. Okay? Na glomerular damage because of course may RBC casts. Dagan pa yung RBCs na nakitaan. So therefore, kung sa may possible, kinsa may na ay glomerular involvement diri sa choices. So the answer there would be unsa man? Glomerulonephritis. That is correct. Okay? So the correct answer is glomerulonephritis. If ganahan mo lang tawag yun sa microscope, kung sa may dapat lang tawon, ang RBC cast. Because the presence of RBC cast, diba, as I've mentioned, basta ganun presence of RBC cast, the first very significant disease is glomerulonephritis. Pyelonephritis, dili ta kang ingon na pyelonephritis. Nga naman, kay walay WBC cast, X na. Yeast infection, na ba nakita ang yeast? Wala po, X na. Cystitis, na ba nakita ang bacteria? Wala sad, so na X na. Renal tubular necrosis, na ba nakita ang RTEs? Wala. So therefore, you're left with glomerulonephritis, and that is the correct answer. Okay? All right? So that's question number 1. Next page. Okay. Question number 2. Ayan. A specimen with a negative nitrite reaction and a positive LE reaction that has WBCs, na ay WBC casts, pero walay bacteria na ko. Asa may na disease makitaan? Sterile leukocyturia. Ito ganito, C?
Acute interstitial nephritis.
Acute interstitial nephritis. Remember, eosinophils have leukocyte esterase. That's why positive siya. Alright? And diba, the presence or the predominant WBCs na nasa imuhang acute interstitial nephritis is eosinophils. Alright? Na kay WBC, na po kay WBC cast because this involves your renal tubules. Okay? And this is usually allergic reaction to a drug or to a toxic substance. So therefore, it's acute interstitial nephritis. Walay bacteria na kitan. Okay? Alright, so number 2 is acute interstitial nephritis. Okay. Next, you have number 3. Ammonium sulfate was added to red urine. Okay? So red yung urine. The urine had a positive reaction for blood, but no RBCs were seen on microscopic examination. So dira panandaan na naka-idea kung unsa. Kani positive siya blood pero wala kay RBCs na nakitaan. And remember that your blood reagent strip can both detect hemoglobin and myoglobin. And remember, asa man makita ng hemoglobin? Dapat na ay RBCs po na makita. Okay? So in this case, after centrifugation, the supernatant fluid is red. Ang supernatant fluid daw is red. So therefore, wala siya na precipitate together with ammonium sulfate. So the abnormal color is caused by kinsa man? No other than
Myoglobin.
myoglobin. Myoglobin, sorry. Myoglobin. O, diba? So take note of that. No, dili palandaan. Urine kay positive for blood. Pero wala kay RBCs na nakitan sa microscopic. So, unsa na lang na pag hemoglobin na anyway, pwede man siya kay na-lyse, no? Ni-lyse ang RBCs. Pero most likely, yun dapat na RBCs na naa. Okay? Alright? But again, ang pinaka makasupport yun is kaning after centrifugation. The supernatant fluid is red. Okay? So therefore, that is myoglobin. Okay. Next. That's page number 3. Page 4. Okay, ito. The SG of a urine sample was determined to be 1.025 using the reagent strip technique. Protein concentration of the sample was at 2 grams per dl, and glucose concentration was also at 2 grams per dl. temperature of the specimen is at 26 degrees Celsius. The calibration temperature is at 20 degrees Celsius. What is the corrected SG of the sample? What's the answer?
1.005.
1.005.
1.025.
1.025. What's my final answer na to?
1.025.
Okay. Sige. So the
0.25,
correct,
sir.
okay. Alright. So ano mang 1.025?
Reagent
Reagent technique.
Very good. Very good. Take note of that. Reagent strip technique for SG doesn't need any correction. So kung sino makita dito, mo na dito siya. Unless ang pH na lang kay 6.5, di ba? So you have to add 0.005. But in this case, wala man dimension. So therefore, you don't need to correct. So kaya kung gibutan diri, pampa-confuse lang na siya. So therefore, ang answer is 1.025. Take note, refractometry and urinometry, dito ta mag-correct. Okay? But for reagent strip, doesn't need to be corrected. So, di-mention na din na reagent strip ang gigamit, so therefore, you don't need any corrections. Okay? If gibutan ako ni refractometer or urinometer, then of course, you have to make the necessary corrections. Okay? For refractometry, again, you don't need to correct for temperature. Okay? Diretso na ka sa protein and glucose. But for urinometer, you have to include temperature. Okay? Ayan. So, sino ang na-fool? Kung sa'yo na-uwat ani. Okay. Minus pa kung tama. Ayan. Ito, medyo mataas. Okay, sige. A prenatal exam during including a routine UA is performed on a 28-year-old female. Alright? Her physical exam is unremarkable. When asked about her health, she states that it is generally good except na sige siyang UTI. Sige siyang UTI. And karon nagtambal siya. Ayan. And kay para to prevent the UTI. Alright? So ang color daw is bright orange and the clarity is clear. So ang question is, what is the reason why nga nung orange urine? Okay, so I'll check. She has a liver disorder and bilirubin is present in the urine. Can you really say that na inanira mo results? I don't think so. Okay, kay kulang. Alright? And aside from that, dapat ang clarity or ang color gibutangan og yellow foam. If mao lang maganiyang ibutang, dapat yun i-specify na na-foam. Alright? Wala man. Okay. But aside from that, if na-foam ko, hindi siya ma-differentiate. But anyway, it's lacking ang information to say na nasa liver disorder. Next, the urine is concentrated, which can be confirmed by the urine-specific gravity. Possibly, pero take note that the clarity is clear. So therefore, your SG will not be totally high because your clarity is clear. That's what you can expect. Okay? All right. Next, over-the-counter product contains phenazopyridine, which imparts a characteristic color to urine. And that is actually the correct answer. Remember that phenazopyridine can also give your urine a bright orange color. Okay? All right? So, and phenazopyridine can also, diba, interfere with bilirubin because usually your phenazopyridine causes pigmented urine. Okay? So, and you mentioned na over-the-counter product. All right? And remember that phenazopyridine is an analgesic, pain reliever sa mga na-UTIs. All right? So, therefore, our answer here is phenazopyridine. Okay? All right. Next, you have, okay, when the laboratorian is using bright field microscopy, a urinary cast that appears a homogeneous matrix, homogeneous sa smooth iyang appearance, well-defined edges, blunt ends, and cracks is most likely, kita man na yung mga cracks, na yung mga fissures, niya smooth iyang appearance, that is your, kita man?
Waxy.
Very good. The waxy cast. Okay? All right. Next, you have number 7. Color of RBC casts using the COVA stain. You have, ano sa yung answer, ano? Akong gibasihan ang ano dears, ang katong table sa last na notes, katong yung summary. And the answer there is red, purple. Okay? Red, purple. Alright, red, purple. Take note of that. Kaya ako siyang i-check po sa Strasbourg, wala na mention. But anyway, datong last na table na itong ano butang. Alright, correct matches regarding reagent strips and their positive color reactions. Of course, bilirubin, tama. Tama ba? Violet ang positive?
Yes.
Okay, very good. Ketones, positive. Tama ba? Red?
No.
Ano sa positive dapat sa ketones?
Purple.
Purple. Yeah, appear siya sa imuhang mnemonics, di ba? BKL. Bilirubin, ketones, and leukocyte. Urobilinogen, yellow ba ang positive?
No.
Red.
Diba? Ano sa positive sa uro?
Red.
Pink.
Red.
Pink.
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 Yeah,
Fun.
pink. P-U-N. U-N. And nitrite, positive, uniform blue.
Pink.
Uniform pink.
Pink.
Very good. So uniform pink, any shades of pink. Alright? So ang positive, ang correct mo therefore is only one only, violet. Alright? Okay, so muna siya dears, ako ngayon ng mga color reactions, so mukhang reagents na possibly yun na magawa sa quiz. Alright. Ayan, next. The following are initial results obtained during a routine urinalysis. Which results should be investigated further? Okay, sige. Okay. A, negative protein, 2 to 5 waxy casts. B, cloudy brown urine, 2 to 5 red blood cells. Mag-start sa taaning letter D. Urine pH of 7.5 na kinakitang ammonium biurate crystals. Is that consistent or dili?
Consistent.
Consistent. Because remember that your ammonium biurate can only be seen in alkaline urine. So letter D, you don't need to investigate further because that is expected. Letter C, clear colorless urine, specific gravity of 1.010. Is that consistent or kailangan pa kamo investigate?
Consistent.
Consistent. Because remember that clear na gani siya, colorless, so maka-expect ka na dili kayo siya concentrated. Lastly, cloudy brown urine, 2 to 5 red blood cells. Is that consistent or kailangan pa kag mag-retest or unsa man?
Consistent.
Yes, that's very much consistent. Because again, your RBCs can produce a cloudy brown or pwedeng red na urine. So therefore, atong answer is letter A. Nga naman, remember that you already have waxy casts, okay? And di ba ang waxy cast, it already indicates extreme urine stasis, na renal failure. So therefore, anong mo negative yapo ng protein? Dapat positive na siya. That's why you need to investigate further. It could be na yung mga false negatives sa protein or wala na-detect ang imuhang sample or na problema. That's what this question means. Okay? So therefore, imuhang answer there is letter A. Kaya namang negative ang protein na nag-waxy cast naman ka. So dapat consistent imuhang result. Dapat walay discrepancy. So therefore, it's expected na dapat positive imuhang protein. Kaya naman kay waxy cast. Okay? So pag sabot ana, padulong na dyan renal failure, naguba na yung glomerulus, imuhang tubule. So therefore, magpagawa sa mga proteins. Okay? Alright. So that's for number 9. Okay? Sige. So okay naman, di ba ang question? Okay. Next type of urinary crystal with cigarette butt. Kasi niya siya na crystal, basta cigarette butt. You have calcium.
Calcium sulfate.
Take note, dears, ang hippuric acid, ha? It can also be seen if you eat a lot of food na ay benzoic acid. Take note, ha? Benzoic acid, alright? It can lead to hippuric acid na crystals. Benzoic acid, okay? Alright. Tama, calcium sulfate. Tama behavior, okay? Question 11. What is the principle of the colorimetric reagent strip? Determination of SG. Kung sa ganyung principle sa SG na to, sa reagent strip, you have
pKa.
Change.
the pKa change. Okay, so therefore, asa may nanay pKa diri? Kanila. Letter A. Ionic strength alters the pKa of a polyelectrolyte. Meaning, if daghang ions, alright, mas daghang H+, di ba, na ma-release, lowering the pKa, so therefore, mahimo siyang acidic, okay, ang imuhang environment. Okay? So, basta pKa change of a polyelectrolyte. Alright, okay. Okay, yes. Yes, tama ron. If repeatedly nga 1.010, ang ibutan naman dito kay one specimen lang. Diba? As I mentioned, if usa ka specimen nimo kay 1.010, then that's okay. Pero if repeated na gani na same patient lang, alright, na sige nga 1.010, then that needs to be investigated because that could indicate loss of glomerular concentration, okay, or concentration of the tubules yan, loss of tubular concentrating ability. Okay? Alright, tama ron. Tama ron. Okay. Sige. Next, you have question number 12. Urine that is dark red or port wine, ako na isa, basta port wine gani ang color, ang sa ganito. Basta port wine, sa ganyan ang cause, anak? Porphyria. Therefore, porphyria, cutaneous tarda. Take note, there's ang lead poisoning, although it can affect porphyrin metabolism, ang imuhang characteristic urine is colorless. Colorless ay yung urine, hindi siya mag-change. Okay? That's according to Har and Kahenry po. So, na-mention ako na sa ato akong metabolic disorders na discussion, lead poisoning is colorless ang ihip. Basta gani port wine, port, okay, port, you have porphyria, cutaneous tarda. Okay, alright. Math, yes. Oh, next na po, yes. Urinalysis results. A patient with severe back pain has the following urinalysis results. O sige. Ano ta sa chemical? Ano sa may abnormal dira? Ano sa abnormal? You have
SG.
Protein.
SG, very good. Kaya taas kaayo. Next, isa pa.
Ano din?
Okay, di kayo voice, Scar. Unsa ilain?
Protein.
Very good. Trace, okay. Unsa pa ilain?
Urobilinogen.
Euro, pwede, yes. And then unsa pa last? Or na pa ilain?
Blood.
Blood.
Your blood. Actually, small, no? That's still significant. Kaya dapat negative ang blood. Okay. So you have SG na taas, 1.030. You have protein na trace, okay? You have blood na small. And then lastly, you have euro na 0.4 mg per dl. Now for microscopic, nako, kung sa may abnormal silang tanan. Joke, check lang. RBCs na 10 to 20. So that's a lot, no? Alright? That's a lot. And of course, you have the Caox crystals. Okay? So based on these results there, siya mo hang possible makuha na information. Kung sa kainin possible na the-experience sa patient. Na siya severe back pain, then napag yung RBCs niyang ibig. Kung sa kainin na disease, if ever, or siyang the-experience, you have sama.
Renal calculi, like nasa kidney stones, sir.
Kidney stones. Very good. And remember, kidney stones, renal calculi. Because remember na kung siya Caox na crystals na daghan. And di ba we mentioned, basta renal calculi, severe back pain, okay, and microscopic hematuria. Remember, di ba? Nakita siya sa RBCs, imuhang microscopic na yung RBCs. Pero sa imuhang physical, wala pa siyang i-change to red because it's microscopic hematuria. Alright? Take note of that. So that's the initial findings of renal calculi. So we go into the question. In addition to the presence of blood, what other reagent strip result relates to the patient's symptoms? Alright? Kung sa may mga result ani na makaingon ka na murag, it's because of this, that's why medyo parang nasa gibatid na symptoms. Kung sa man?
Yes, Jesus.
Your
SG.
your SG. Very good. Magaling. Specific gravity. Remember, your specific gravity is highly concentrated. So therefore, that facilitates the precipitation of the crystals and the formation of your solutes or the formation of your crystals. Diba? Remember, although na pH, acidic siya, but you remember that the spec gravity is highly concentrated and that really contributes to the formation of the crystal, okay, or of the kidney stone. So therefore, atong answer here is specific gravity. Okay? So I hope na-gets na to siya. Alright? Okay naman lagi. Naka-answer naman lagi. Okay. Sige. Next, question number 14. Ayan. Naku. Which of the following positive chemical reactions is mostly closely associated with the presence of yeast in the urine sediment? Diba? I mentioned na if kayo makitaan sa chemical reaction, then sa microscopic maka-expect ka na ay yeast. Okay? Possibly na complication. Ano sa man? Okay, very good. Glucose. Take note. Because if positive ang glucose, again, possibly nadaghan pong yeast. Okay, because remember, the yeasts would like the highly rich sugar environment. And aside from that, glucose also upsets the pH, all right, of the normal flora dito sa vagina or wherever, which leads to proliferation of yeast. So take note there sa, even if mag-enter na mo, makakita ka positive na glucose, taas kayo. Look at the microscopic. Most often than not, makakita dito ka yeast cells. Okay? All right. See. So that's number 14. Number 15. Which of the following urine characteristics provide the best rough indicator of urine concentration and body hydration in the physical? If makakita ka ani, you're hydrated and you're not hydrated. That's correct, no? Color. All right? Color. All right? So because if dark kayo ang color, it means na medyo kulang kag water. Okay? And if lighter ang color, then that indicates na medyo you're hydrating well. Okay? All right. Easy question. Okay. Next, cholesterol crystals. Cholesterol crystals will most likely be observed in the urine that contains letter A, triple phosphate, B, 4 plus na protein, C, 3 plus na glucose, and letter D, WBC casting. Unsa man?
4 plus protein.
4 plus.
4 plus proteins po.
4 plus protein. Ano naman 4 plus protein?
Anong dili man, sir?
Unsa man? Nga naman 4 plus na protein, so may mong gina-expect ani? Wala ko din extra. So sa ito na disease
Nephrotic
gani?
syndrome, sir?
Nephrotic, sir.
Nephrotic syndrome. So therefore, if na cholesterol crystals, you're expecting that the patient may have nephrotic syndrome. So may another characteristic of nephrotic syndrome, it's proteinuria. So therefore, 4 plus na protein. Okay? Alright, so you're expecting na the patient or kani siya na siya nephrotic syndrome. Okay? Because pathognomonic in a way or very distinct na sediment na makita in patients with nephrotic syndrome is cholesterol crystals. Naku, sana naman. Okay? Sige, tagabalik-balik sa nephrotic syndrome guys. Akong gina-highly emphasize here. Alright? Number 17, how can hexagonal uric acid crystals be distinguished from cysteine crystals? So itong answer, you have letter A muna. Cysteine crystals form at neutral or alkaline pH. Uric acid forms at neutral to acidic pH. Is that correct? First question, is cysteine an abnormal or a normal crystal?
Abnormal.
Normal, sir.
Normal or abnormal? What's yun?
Abnormal.
AB normal, sir.
AB.
Abnormal. Very good. So therefore, as mentioned, abnormal crystals, as again in a pH, who precipitate?
Acidic.
Acidic.
Acidic. Very
Acidic,
good.
sir.
So therefore, ang letter A is not the answer. Letter C, cysteine is insoluble in hydrochloric acid, but uric acid is soluble. Is that correct?
Mali, sir.
Mali, sir.
Baliktad, sir.
Letter C is not correct. Letter D, cysteine crystals are more highly pigmented. Na-mention ba natin na pigmented ba si cysteine? Diba? This is
Colorless siya usually,
remember,
sir.
yes. Your uric acid pa mismo ang color yellow, diba? It could be yellow-brown. So therefore, the correct answer is letter B. Basta gani cysteine, cysteine of uric acid here, always take note of the cyanide nitroprusside test. Because si cysteine is positive, negative si uric acid. Take note of that. That's the test yun na maka-differentiate nila. No? The cyanide nitroprusside test. Okay? Positive C, cysteine. So how do you remember? Cyanide, letter C. So kinsa po yung positive? Si letter C. Okay? Cysteine. Alright? Take note of that. Okay. Alright. Sige. Okay. Next, you have question number 18. Ka-answer naman lagi. Oh, sarot. Okay. Reporting of cysteine crystals. Reporting of cysteine crystals. Unsa man si cysteine? Is it a normal or abnormal crystal?
Abnormal.
Abnormal crystal. And unsa kanang itong reporting for abnormal crystals?
Average per LPF, sir.
Average number per LPF. Very good. And natong mnemonics for that is cast crabs. Okay? Now, if ang question is the reporting of bladder cells, what do you think ang mga bladder cells? Your bladder cells are the bladder cells, your bladder cells. The transitional epithelial cells. So again, asa man ang reporting ng transitional epithelial cells, it is appeal sa mnemonic na TT bayan. And that is RF MOMA per HPF. Kung bladder cells ang ingon. Take note ha, bladder cells, it means they're transitional epithelial cells. Okay? So for cysteine abnormal crystals, okay, then the answer is average number per LPF. What ibang question kay reporting of calcium oxalate crystals? Calcium oxalate, that is a normal crystal. So therefore, asa man siya na mnemonic? Appeal.
TT, sir.
RF
Sir.
So therefore, your answer would be letter D. Take note of that, dear sa base na may mga inana na questions. Okay? Alright, very good. Number 19. Ayan, ako. Patient's random urine consistently consists of a trace of protein. Pero walay cast, walay cells, walay other biochemical abnormality. So makayon ka na, okay, the patient is just well. Ihang glomerulus is functioning well. Wala may cells, walay casts, walay anything. And the first voided morning sample is consistently negative for protein. So therefore, kung sa ganing siya, kung negative ang first morning pero positive na ang succeeding after pila ka hours of standing, pila ka hours of working, this is your
Orthostatic, sir.
albuminuria. Very good. So orthostatic proteinuria. Na kay key. First voided morning sample is negative. Pero ang succeeding na random urine kay positive. Kaya wala ka kabalo if nagtindog ba siya for pila ka hours, naglakaw siya or whatever, that contributed to the orthostatic proteinuria. So the answer is orthostatic proteinuria. Pero, if ang question diri dears, kay na ay trace of protein, then ay mga cast, dayon ang first voided morning pag yun kay positive sa protein, so therefore, makaingon ka na ay early glomerulonephritis. Okay? Alright. Yes? Any question? Any question? Okay. Alright. So that's question number 19. For 20. Ayan, okay. Sige. Situation, urinalysis of a sample from a patient suspected of having a transfusion reaction. Nako, so kung transfusion reaction, maka-expect ka na naay, kung saan man. If mag-transfusion reaction, di ba, kung sa ganyan ang possible na may tabo sa body, there is, kung saan man. There is,
Hemoglobin.
there is, kung saan conditions sa sulod, there is,
Hemolytic transfusion reaction.
yes, there is intravascular hemolysis. Ayan, that's my point. Okay, so it will release hemoglobin. Tama din naman. Okay. Now, you mentioned here that there are small yellow-brown crystals in the microscopic examination. The dry reagent strip are normal with the exception of a positive blood and trace positive protein. The pH of the urine is 6.5. What test should be performed to positively identify the crystals? So, kinsa ganitong granules or crystals na mo positive or makitan after ay hemolytic episode. Kinsa ganitong tawag ato? Si?
Hemosiderin, sir.
The hemosiderin crystals or granules. And again, ang ato ang test to detect them, your
Ruse test, sir.
Russian blue stain.
the Ruse test or the Prussian blue stain. So therefore, we're detecting hemosiderin granules here. So the best test to perform is the Prussian blue stain. Okay? Alright, sige. Okay lang, di ba? Kaya naman good. Charot. Okay. 21. Ayan. Nako. Nako. 21. Urinalysis results. Leukocyturia, taas imong leukocytes. Bacteriuria, dahil mga bacteria. WBC cast, nako. Bacterial casts. Microscopic hematuria and proteinuria. Ano sa may disease? Kanilang na reaction.
Pyelonephritis.
Unsa na type of pyelo? Your
Acute.
acute or chronic?
Acute.
Final?
Final.
Acute final.
Alright, the correct answer is acute pyelonephritis. Take note, if nakabutang na diri dears, waxy, broadcasts ang appeal, then dito na kamo answer of chronic. Remember that I mentioned na mga waxy, mga broadcasts, it indicates chronicity, dugay na siya na disease. So in ani lang ang result, walay waxy, walay broadcast, then that is acute pyelonephritis. So, di ba? Basta na gani WBC cast, nako, press the buzzer, and bacterial cast, nako, that indicates involvement of the kidney tubules, bacterial infection. Okay? Alright, sige. Next, you have 22. Which of the following set characteristics differentiates waxy cast from fibers that may contaminate the urine sediment? Okay. Letter A. Waxy casts are more refractile than fibers. Is that correct? Is it more refractile ba ang mga casts compared to your fibers? This is actually false. Your fibers are more refractile compared to your waxy casts. Ay, joke lang. Teka lang. Tama. Yes. They're more refractile than your waxy casts. Okay? Next. Waxy casts are thicker at their margins. The fibers are thicker in the middle. Tama ba? Na-mention ako din. Is it thicker in the middle ba? Ang fibers? This is actually also false, dears. No? The waxy casts or mga casts ang thicker in the middle, and then ang fibers ang naay thicker sa edges. Okay?
I hope your future girlfriend remembers that would be self-harm.
And then ang letter G, waxy casts have rounded ends. Fibers do not. Ano na nangyayari dyan? Okay.
Party na sir.
What's that? I saw it, huh? Okay. Well, waxy casts have rounded ends, fibers do not. Is that correct? Okay, actually, this is also false, dears. Your fibers can also have rounded ends. Okay, so the correct answer there is letter C. Your waxy casts and casts do not polarize light, but your fibers, they are highly, they can polarize well. Okay, all right. See, so that's for your differentiation. Okay, all right. See. Take note of the differences. 23. Which of the following statements regarding the microscopic exam of urine sediment is false? Letter A. If large numbers of RBCs are present microscopically, then the chemical test for blood should be positive. Is that correct? If daghang RBCs microscopic, dapat positive siya sa imuhang blood. Is that correct?
True.
Yes, so this is true. If large numbers of Cas are present microscopically, the chemical test for protein should also be positive. Is this correct or real?
True, sir.
Okay, true, very good. If urinary fat is present microscopically, then the chemical test for protein should also be positive. Is that true or false?
True.
True.
That's very good. True, because remember, nephrotic syndrome, and the fact na nigawas na ang fats, which are large molecular weight substances, meaning ang protein po nigawas na, okay, because naguba na ang shield of negativity, all right? And therefore, your answer there is letter D. If large numbers of leukocytes are present, then bacteria are present. That is false, because not all the time na naay leukocyturia na po'y bacteria, such as acute interstitial nephritis or mga other causes of UTI na dili bacteria. All right, so that's for letter D. Okay. All right, 24. Ayan, 62-year-old patient, hyperlipoproteinemia, large amount of protein in your urine, massive proteinuria, fatty, waxy, granular, cellular cast, oval fat bodies, daghang fat sa ihi, daghang protein sa ihi. Unsay answer? You have
Nephrotic.
nephrotic syndrome. Bala mo dala, siguro lang emphasize, okay? Taas ang protein, daghang fat sa ihi, wag na mag-isip, that is for nephrotic syndrome. All right. 25. Reagent strip reaction for blood produce a uniform blue color. On microscopic examination, nakitang 8 ghost cells. And remember, 8 ghost cells are RBCs na nilys. The results therefore indicate na the patient has, the patient has hemoglobinuria, all right?
Hematuria. Kaya wrong man akong hemoglobinuria.
Yes, the correct answer is hematuria. Remember that ghost cell siya, meaning na RBCs na una. Nilys lagi siya, that's why uniform ihang color. That's why hemoglobin na lang na-detect. Pero originally, hematuria siya, kaya na may na-lys na RBCs. If it is already true hemoglobinuria, means sa start pa lang daan, hemoglobin din ang ninigawa sa ihi, then therefore, dili ka dapat makakita ang mga ghost cells. Okay? Kung true hemoglobinuria, in cases of massive hemolysis. But in this case, nakita 8 ghost cells. So therefore, di kan siya RBCs na nilys ang imuhang uniform blue na color. So therefore, the initial condition of the patient is hematuria. Okay? All right. So that's for question number 25. Okay. 26. The following are initial results. Japon. Which results should be investigated further? Parehas kanina. Letter A, negative protein, 0 to 2 hyaline cast. Is this consistent? Is this normal or sama?
Normal.
Normal. Okay. All right. Sige. That is correct. No, normal, because remember that hyaline casts can be excreted at a normal rate, no, 0 to 2 per LPF. And pwede lang negative ang protein, ana. Okay, because wala problema sa glomerulus. Check. Letter B, urine pH of 6 calcium oxalate crystals. Is this consistent or dili?
Consistent, sir.
Yes, consistent. Because again, remember that your Ka-ox is your acidic. So therefore, this is consistent. Letter D na lang. Amber urine with yellow foam, negative sa bilirubin pero positive sa ecto test. Is this consistent or dili?
Dili, sir.
Dili.
No,
siya
sir.
consistent. Dili po. Okay, all right. Sige, all right. Okay. Actually, this is very much correct lang. And remember, although negative sa bilirubin, iya mag-confirm ang ecto test. Okay, which is the confirmatory na chemical test. Okay, so therefore, this is still consistent. You don't need to investigate further because it could be that the reagent strip reaction for bilirubin has been affected or basing gamay pa iyahang concentration. Wala siya na-detect sa imong reagent strip. But the fact na iyahang i-confirm sa imong ecto test, then already na-investigate further na niya. Actually, the correct answer is letter C. Nga naman, tanawa ang spec graph. Naabot og 1.050. And remember, di ba, we mentioned that it's physiologically impossible to reach 1.040 and above. So therefore, ganun man inani. So you need to investigate further. So you have to look if na ba siya radiographic contrast media siyang ihi or unsa may possible na ano ani. Because again, look at the spec graph, it's too high. Okay? Dili na siya, wala na siya na lalapas na siya sa normal, di ba? And it's physiologically impossible na maabot ay na level. Unless na lang if na ay radiographic contrast media sa ihi. Alright? So, muna siya yung kailangan i-analyze further. Okay? Alright, see. That's for number 26. 27, which of the following urine specimens is considered abnormal? It's a may normal ani. Clear yellow urine that becomes cloudy upon refrigeration, freshly voided na brown and clear, freshly voided na yellow and cloudy, and clear yellow urine specimen that changes color upon standing. So it's a normal urine ani.
A.
Or normal. You have? It's a letter.
A.
A.
Okay, very good. Letter E. Because it indicates lang the precipitation of amorphous substances after refrigeration. Ang freshly voided urine na brown, that could indicate na ay bleeding. Yellow and cloudy could be increase in WBCs or bacteria. And clear yellow specimen that changes color upon standing. So possible na ay melanuria or homogenesic acid or ganun. Okay? So ang normal mo is letter E. Okay? Alright. Next, 28. A positive glucose oxidase test pero negative sa reducing sugar, it indicates that you have
Dili na siya false positive, sir.
I know bitaw
If,
no. Like,
if
nasayo ko ani.
if reducing sugar ang negative.
Yeah. Gets. I think ano din ay tama. Positive glucose oxidase and a negative test for reducing sugar. Yeah, tama yan. I think nasayo ko time ari here. Sorry. Okay, alright. Yes. I think this is false positive. Sayo pa kung ano. So, chapter ako na mag-retake ka. Because if true glycosuria di siya, dapat positive po siya sa reducing sugar. Tama. Because your glucose oxidase test is highly specific for glucose. So therefore, and glucose is a reducing sugar, so dapat positive test po siya din. So this is a false positive reagent. Strip, tama. Thank you. Okay, so, alright. Magkamali ako. Okay, very hard, dark-colored, rough renal stone. It may be due to, kinsa man siya ang very hard, dark-colored renal stone. Kinsa man ni? See?
How?
Sir.
Calcium oxalate. And usually, asa di ka ng calcium oxalate if taas ka og, kinsa man? Kinsa na food?
Ascorbate rich.
Ascorbate, sir.
Ascorbate-rich food. Kung urine-rich food, that's uric acid. Proteus vulgaris, of course, that's for struvite or staghorn. Disorder with defective reabsorption, your Fanconi syndrome, and that is usually indicative of cysteine na calculi. So therefore, atong answer here is increased ascorbate-rich food. All right, last na. 30. Which of the following are characteristic urine findings from patient with hemolytic jaundice? Kinsa man?
Negative bilirubin.
Negative bilirubin,
Increased
sir.
Increase.
Urobilinogen.
Okay, alright. So therefore, the correct answer there is letter A. Negative for bilirubin and increased amount of urobilinogen. Your liver is still working properly, so tanang unconjugated bilirubin ma-convert to conjugated. And since daghan mang conjugated bilirubin na na-produce, daghan pong urobilinogen na makitaan sa ihi or ma-produce. So therefore, negative ra for bilirubin, kaya wala naman ni leak, wala ra niya sa bloodstream muhang bilirubin, pero imuhang urobilinogen kay daghan mang conjugated bilirubin na na-produce, so therefore, daghan pong urobilinogen na ma-detect. Okay? Alright. Very good. Last two na lang. Red-colored compound. Nako. Insoluble in chloroform and butanol. Kinsa kanina? Bawat nang discuss. You have?
Orphobilinogen.
Yes. Orphobilinogen. Urobilinogen is soluble in both. Okay? Ehrlich reactive is soluble only in butanol. Take note. Soluble in both. Soluble only in butanol. Insoluble in both. Okay? Alright. And last na lang, 32, you have, which of the following reagents is for urobilinogen? Kita nito, C.
PDAB.
Alam niyo na. P-dimethyl amino benzaldehyde. Alright? And that's for the quiz. Okay? And last na lang mga questions for other body fluids here sa akong i-share. Atong i-practice. Alright? So, kamusta ang quiz? Karon, na na-rationalize na nato. How was it? Disodra gapon, sir. Kamusta man? Diba sa yun ra?
Sa'yo na ikaw mo answer, sir.
Ikaw ko mo answer.
Ikaw na lang answer sa conference.
I'm hoping na ano lang, sa'yo na yung concrete. I feel like sa'yo yung concrete. Okay? Alright. So, for other body fluids lang, dears, ayan. So, number 9, an unknown fluid can positively be identified as being CSF if, kung saan na itong natawag nila, Sa itong protein or substance atong pwedeng ma-check.
Transferring.
Ano yun? It's your, say letter. Isa na letter.
D.
Letter B. Okay, very good.
D.
Your carbohydrate deficient transferrin, also known as, minsan siya, C. Ay, ba yan? C.
Tau.
The
Tau.
tau transferrin. Okay? Tau.
Transferring.
Tau transferrin. Okay? Ako na sabi ano dito sa highlight. Oh my God, what's happening? Okay. Oh, what's ako mouse? Okay, ayan. Alright. So, letter D. Okay? Alright. Number 10, ayan, compute for the sperm count. Sige, mag-computation ka. Sperm count ang ibutang ha. So, 50 sperms counted in 5 RBC squares. Take note, lang tawag ang dilution. Nako, dili siya 1:20. So, in this case, sa atong buhaton, mugamit ta sa original formula. So, ato lang i-take note. Sige, pag-solve food mo. So, 50. You have a dilution of 10, all right? And then, take note has sperm count, all right? Ang imuhang okay. Sige. All right, so saan yung answer? Sperm count has sperm count. Take note. Again, if na yung mga solving theirs, it's most likely sa ano din na, sa sperm, okay? All right. So,
Iba, sir.
sperm count,
50 million.
letter.
D, sir.
D, sir.
Letter D. Very good. 50 million per ejaculate. Take note again, di ba? If sperm concentration lang, ayan, sperm concentration, kutubra ka diri. Asa na to? Ayan, 25 million per ml. Okay? Now, sa igit na ito pag-solve, 50 times 10, because 50 sperms counted, times 10, dilution factor over, area is 0.2. And remember, 5 ka-RBC squares. And 1 ka-RBC square is 0.04. Times 5, so 0.2. Times, ang imong depth na 0.1, so you will have 500, saan to? 500 over 0.02, which is equivalent to 25,000 per UL pa ni siya years. So you have to multiply that by 1,000 to get 25 million per ml. And since we're talking about sperm count, so you have to multiply this by the volume, which is 2 ml. And take note, ang imong final unit is per ejaculate. So 25 million times 2 ml, that's 50 million per ejaculate. And that is your sperm count. Okay? So take note mga solving ha. Alright. Next, pleural fluid is submitted to the laboratory, milky in appearance. What is the best test or most useful test to differentiate chylous and pseudochylous effusion? Ito kong i-mention. Sa ganito na test, your
Tag.
letter E, triglyceride ratio. Fluid to serum triglyceride ratio. Very good. Okay. Number 12, ayan, amniotic fluid for OD450 is unacceptable if na blood because oxyhemoglobin mo absorb food siya. And at what nanometer? Kung sa nanometer ang absorption ni oxyhemoglobin, it's
410.
410, sir.
410, oxyhemoglobin. Oxyhemoglobin is 410, bilirubin is 450, meconium, katong first fecal stool is 350 to 400. But take note, 410 nanometers si oxyhemoglobin. Next, ayan, app test, ayan, to detect the presence of fetal blood and maternal blood in the infant's stool or vomitus. Again, unsa tong reagent na itong ginagamit, it's your, sa to, app test, kalimutan ang feces. Kinsa man, kinsa may reagent? Your 10% pa or 1%?
1%
Your 1%. Very good. Take note. Muna akong point there sa mga reagents ang ginagapangutana. Again, myelin globule sa sputum. It resembles, kinsa ganito? It resembles blastomyces. Okay. Alright. Very good. Next, condition in which a patient shows no response to gastric stimulation. 0 ang basal acid output. 0 po ang maximal acid output. Takin sa ganini si
Pernicious
pernicious anemia. Alright, very good. Take note of that. So therefore, since ito na-disease na highest levels of gastrin, okay? Highest levels of gastrin.
Tollinger.
ZE syndrome.
Number 16, kanina dears lang ako na-mention, pero ako nag-appeal. This is known as the Sims-Hanner's test, alright? This is a post. It measures cervical mucus, okay? And the ability of the spermatozoa to penetrate the mucus, okay? So Sims-Hanner's test. Ako rin i-upload tonight, after our lecture. Okay, 17, ayan. Which of the following is not a test to evaluate the surfactants present in the fetal pulmonary system? Kung sa may mga test din na dili for fetal lung maturity, it's your letter what's man?
Sir A.
A ba? Para sa din letter A, para sa din letter A, it's for
Bilirubin.
okay, take note, very good, that's correct. This is the correct answer. Your letter A, this is for test for, oh my god, something's wrong with my mouse here. But anyway, letter A atong answer. Okay, this is a test for HDN, hemolytic disease of the newborn. All right, take note. Next, 18, synovial fluid, serum uric acid is normal. Okay, pero pag lataw niya sa polarized light, na yung mga crystals na nakitaan. So, what's a possible reason nga nung inani siya? The patient has septic arthritis, it was collected in powdered EDTA, it should not have been anticoagulated, or the patient has gout. Serum uric acid is normal, pero naay nakita ang crystals na nag-polarize sa gyapon. So it could be that, unsa may error ani. The
powdered EDTA.
Very good. The letter B. The specimen is collected in powdered EDTA. Remember, di ba, it's not recommended na mag-powdered anticoagulant ka when we examine synovial fluid. Why? Because again, mo interrupt siya sa crystals identification. Alright, so letter B. Their specimen is collected in powdered EDTA. 19, ayan, as mentioned, how do you report bladder cells? Your transitional epithelial cells is again appeal sa TT bayan, okay? So that is RF MOMA per HPF, okay? And lastly, what is the SG of triple distilled water when measured by refractometer? So get out.
1.000.
1.00, okay?
1.00.
Okay, very good. So take note there sa bahalag triple iangalan, it's still distilled water. So ang answer na to is 1.00. Okay, so 1.00 pa rin. Alright. Now, remaining lang there's case studies. Ayan, daghan kayo siya, no? Pero ako lang, this is from Branzel para at least maano mo. So, diretso lang ta sa iyahang presentation. So again, 30-year-old female, nag-fever siya, tenderness and pain sa iyahang ribs, dapit. Urination is sometimes painful and must urinate daw siya kinadaghanan. Or sige siyang urinate, no? Results na to, again, as you can see, blood is traced, protein is 30 mg per dl, and positive po siya for SSA, and LE is positive. Alright? Now, look at the microscopic. Lantawa din sa casts, na siya WBC casts. So therefore, at kita sa number 2, what is the most probable diagnosis? Na siya WBC cast, na napod siya bacteria na moderate. Okay? Insa man, that's your sa itong discussion. Sa itong diagnosis. It's
Upper UTI.
very good. And 3, which is the single microscopic finding in differentiating upper UTI from lower UTI? Ang sa ganito, your
WBC.
And another name for this condition is unsa ganito? It's known as your
Pyelonephritis.
pyelonephritis. Take note, wala siya po siya yung mga granular, wala siya yung mga waxy, mga broadcasts. Alright? So, para siya dears, look diretso sa microscopic na ba yung mga pang-press the buzzer dito. Ato ka sa chemical na aba, alright? And sa physical na aba. Okay? Next. Ayan, last na lang, kapit na. Alright, 6-year-old boy, ayan, nagka-lethargy daw siya. Bago na siyang gikan o nagpa-vaccine, okay? And nagdiso na siya pangihi, alright? Now look at the chemical exam. Look at the chemical exam. SSA is 3+. Your protein is 500 mg per dl, alright? The rest of your chemical exam is medyo normal lang. For physical exam na ay white foam that does not dissipate, hindi siya daling matangtang. So therefore, unsa may pasabot na taas kayo ay unsa taas na level ani ngano na may white foam, it's your protein. Now another, unsa pa nakita nimo, you have WBCs, you have casts there, amorphous urates, all right? But again, ang pinaka-distinct yun is your SSA and protein. And again, pag nagani proteinuria, massive proteinuria, this is considered or kinsay possible na disease. Number 6 muna, it's
Nephrotic
massive
syndrome.
proteinuria, nephrotic syndrome. And nephrotic syndrome, we have proteinuria is what type? It's
Glomerular
glomerular proteinuria. And last case study, ayan, case study, 20-year-old woman, nag-ambisip siya, alright? Look at the chemical results. You have NE positive, alright? Normal rang uban, okay? Next, look at the RBCs. Okay. Look at the microscopic exam. Of course, you have WBCs there na 10 to 25. You also have WBC casts, all right? You can see moderate RTE cells, okay? So, may mga moderate RTE cells, all right? For the bacteria is only few. So, therefore, unsa may possible disease ani? Ibutan pa dyan na sa hand cell stain, 12% ang eosinophils. So, dila pa lang daan, very consistent. Unsa may possible diagnosis, you have
Interstitial nephritis.
acute interstitial nephritis. And the proteinuria in this type is unsa man? It is a pag acute interstitial, it is
Tubular
tubular proteinuria. Okay, so interstitial tubular proteinuria. All right, and that's dears, that's the end of our ratio and all that.